There is your question. Okay, so if you have read and understood considering age, surgical, anatomy station, kindly tell me if you can identify the bone in A and B.
Yes, ma'am. It is the scapula that
Okay,
showing
which side?
in A.
Yes.
So in A, ma'am, 2 is acromion.
Yes. Can you identify this is scapula of which side, please? Right or left?
It's right side.
All right. Okay. Now, if you can identify, where is my cursor? Yes. 2, please.
It is the acromion.
Okay. If you can identify 10 over here.
Spinous process.
Can you identify 5 over here?
Infraspinous fossa.
Okay. If you can move on to picture B, and here it says 2. If you can identify that, please, with my cursor.
Coracoid.
All right. 3. If you can identify this, please.
Acromion.
Can you tell me, in this picture it's showing something. If you can identify the 2 structures that I'm pointing
One
at.
is a
Yes.
humerus, head of the humerus, and
Yes.
one is a glenoid of the scapula.
Can you please tell me how the shoulder girdle is formed?
It is formed by the joint of the that consists of the glenoid cavity and head of the humerus.
And
acromioclavicular joint.
anything else?
What
are the factors which stabilizes the shoulder joint?
2 types of the factor. One is the static, another one dynamic. In static, the capsule of the shoulder joint, glenoid, labrum, and the ligament of the shoulder joint. While in the dynamic, there is the tendon of the rotator cuff that consists of supraspinatus, infraspinatus, teres minor, and subscapularis.
Can you
And deltoid
name can you name the tendons or ligaments which support the shoulder joint, or which contribute to the stability of the shoulder joint? Please.
Anterior and posterior and lateral glenohumeral ligaments.
Okay.
And
coracoacromial. Yes.
acromioclavicular and coracoaclavicular ligament.
What do you understand by the term rotator cuff muscles?
Rotator cuff muscle provides stability to the shoulder joint.
Yes. Can you name those?
And it consists of 4: supraspinatus, infraspinatus, teres minor, and subscapularis.
And what are the nerve supply of all these 4?
Supraspinatus and infraspinatus supplied by suprascapular nerve, and nerve to the subclavius supplied by subscapularis, and teres minor supplied by the axillary nerve.
Kindly tell me the origin and insertion of teres minor muscle, please.
Teres minor is
originates from
from the medial side of the scapula, I guess, and it's inserted
upper
to the
2/3 of lateral border of scapula or the dorsal aspect. And then where does it insert, please?
It inserted in just posterior to the greater tuberosity of the humerus.
Very good. Okay. Can you tell me what are the function, or what is the function of these rotator cuff muscles? What do they do?
They provide stability to the shoulder joint,
Okay.
and individually, supraspinatus is doing the abduction for the first 15 degree,
Yes.
and subspinatus is the internal rotator of the shoulder, while the teres minor and infraspinatus are the external rotator of the shoulder.
Okay. Can you here you identified number 3 as the coracoid process. Can you please tell me what are the structures which are attached to this? Where is my cursor? Coracoid here. Coracoid
Yes,
process.
ma'am. 3 ligaments and the 3 muscle are attached there. In ligaments, one is coracoacromial, coracoclavicular, and coracohumeral ligament. While in the muscle, one is the short head of the bicep, second is the coracobrachialis, and third one is the teres minor.
No, pectoral.
Sorry, pec minor.
Okay. All right. Can you tell me what are the muscles which are inserted in the bicipital groove?
3 muscles are
One
inserted.
is humerus. Yes, please.
Pec major on the lateral side and teres major on the medial side. In between, there is a little darcy.
Yes. Okay, good. Right. You can tell me about the insertion of the long head of the biceps muscle.
Long head of the bicep are inserted at the
All right.
radius.
Shoulder
Radial
joint
tuberosity.
is most unstable in which position? In which movement it becomes most unstable?
In external rotation, I guess.
Okay. We'll discuss that later. All right. Can you please identify, can you please tell me what kind of image are you looking at first of all?
This is the MR arthrogram of the shoulder joint.
All right. Yes. Can you name few indications in which this image can be asked?
Yes, when there is a suspicious of labral tear, soft tissue injury,
Yes.
and any ligamentous injury.
Yes. Or after trauma, we need to rule out. Okay.
Yes.
Can you please identify the blue circled structures? Number 1, please.
Yes, one is acromion, 4 is
Yes.
a clavicle,
Yes,
and
please. 5.
5 is the deltoid,
Yes, please.
and 6 is the glenoid.
Yes, 6. Okay. Can you please tell me the origin and insertion of deltoid muscle?
Deltoid originate from the superior aspect of the humerus, head of the humerus, and inserted into the deltoid tuberosity of the humerus on the anterior aspect, anterolateral aspect.
Can you please tell me what are the factors which contribute to decreasing the stability of the shoulder joint?
One is shallow joint and capsule, labrum.
Shallow joint cavity or the glenoid cavity. Yes, and
Yes,
then
capsule.
yes, capsule when it
And
becomes lax. Yes,
yes,
and inferior
and
the
yes,
shoulder, because that is the most lax point, or that's the most point where it is not supported by the structures or the ligaments. All right.
yes,
Any other? Any more
and then
factor because
legs
of
ligament,
the yes, please.
legs ligament, and legs tendon.
What about the quadrangular space? What about it? What passes through it, and how is it bounded? Please.
Condylar space passes two main structure. One is the axillary nerve and posterior circumflex humeral artery.
Yes.
It is bounded by lateral side by the shaft of the humerus on the
Neck of the humerus,
medial
yes. Medially.
on medial sides. It is bounded by the A tricep, I guess, long head of
Long
the
head,
tricep,
yes, and
and superiorly it is bounded by teres minor, and
very
inferiorly
good,
teres major.
very good, excellent. All right, right. What can you tell me about the axillary nerve? What are the muscular supply of axillary nerve? It would be
Is the nerve
rather
supply
easy.
deltoid and teres minor.
Very good. What is the area that what is the area sensory supply, or what is the area which supplies by the axillary nerve?
Regimental wedge area
Yes,
of the lateral side of the arm.
very good. Okay, good. Thank you.
Thank you, ma'am.